Over the last 5 years, Well Doncaster has demonstrated a continued commitment to utilising community-centred approaches in creating a community-led health and wealth approach to reducing inequalities. We strongly believe that we cannot close the health gap without involving, listening and engaging with those most affected, and so consistent community conversations has been an essential characteristic of the Well Doncaster approach. Communities need to own and be a direct part of the design and delivery of solutions. We see every day that our communities are brimming with energy and innovation, and we are looking to maintain a major focus on building capacity and releasing grassroots energy and ideas. We have been a leader in using asset-based community development, ABCD, in approaching local challenges and opportunities, and feel embedding these ways of working with individuals, families and communities is crucial to the achievement of Team Doncaster's overall vision. Utilising the Public Health England framework for community-centred approaches for health and well-being, we have developed 3 key areas for enabling change: individual, community and organisational. Let's start with individual. We are supporting individuals to recognise what will have a positive impact of their health and well-being and develop tailored support towards greater independence. Well Doncaster has promoted personal development through securing European funding for Community Wealth Builder, which supports social enterprises and commissioning bespoke business startup support and as avenues to greater financial security. Supporting behaviour change and self-efficacy through Be Well Doncaster, which provides one-on-one support in understanding and tackling the root causes of ill health and empowers people to access hyper-local community support. Developing social support through the establishment of community peer groups, which promote health literacy to support residents to better understand and self-manage their health. The next approach is community. Well Doncaster focuses on 20 communities and has developed in-depth population health management community profiles to understand the assets and challenges of both people and place. Coupled with ongoing community conversations, this insight allows us to better understand complexities and priorities and develop co-produced plans for each community. This includes building resilience, social capital and increasing community resources by having a dedicated Well Doncaster officer in each priority community. Well Doncaster is a key partner of Get Doncaster Moving and manages a local grant scheme that removes barriers to being active. The Active Communities Grants Panel is resident-led and links with a network of community connectors, reporters and explorers who represent and advocate for their communities. Developing and strengthening community leadership at a grassroots level is key for sustainability. We have been establishing and strengthening positive activity groups where residents develop skills and access resources. Facilitating collaboration across the third sector is leading to hyperlocal solutions and greater community capacity, which will be facilitated further by a stronger move to locality participatory budgeting. COVID-19 has been a significant risk to the resilience of our communities, and we have been supporting communities to continue and adapt. The Well Doncaster team has been in constant contact with communities to understand and respond to shifting challenges through providing guidance, PPE, and supporting food banks in accessing supplies and funding. The final approach is organisational. Since 2015, we have been building an evidence base of locally used community-centred approaches to influence corporate ways of working. This has included championing public health intelligence through population health management community profiles and feeding community insight and intelligence into local decision-making. Influencing policy change through developing networks across the third sector. We have facilitated a voluntary, community and faith sector community of practice, which is building a culture of collaboration and access to community resources and training. These networks will inform the redesign of services through locality commissioning. By focusing community-centred approaches at an individual, community and organisational level, we have the best chance of closing the health gaps that have only widened through the COVID-19 pandemic, and work together in building vibrant, resilient communities across Doncaster.